want to ask, how do you encourage your patients to report immune-related or adverse events early enough to your office?
Yes, Lisa. Again, making sure that we are promoting multiculturalism in oncology care is really important. Patients are coming again from different backgrounds and they do have their own cultural beliefs. I had actually a patient from India and they were strongly believed that the treatment is working because they are taking turmeric, the fresh turmeric every day, diluted in milk with a little bit of honey. That is what has helped him. It was a male patient. And then the daughter was telling me that that is the only thing that we are planting in our backyard with all these plants. So we will have the fresh turmeric for my dad all the time. And then in winter also, we will bring them in. So this is the only belief the patient had. You could not get turmeric away from this patient with that strong belief that from childhood, it was helping us with all the anti-inflammatory ingredients that turmeric has, and we all know that now. So it was hard to make sure the patient understand that it is not all about the turmeric. You're receiving the great treatment available, and I want you to call me if anything goes wrong, not just increase the dose of your turmeric that you are taking every day. And turmeric is something that is like safe, and we do not ask the patient to stop while on treatment. But these are other things like patients with Asian background, when they come and then they have this specific mushroom in their pocket, and then they just even don't want to show that to us. And accidentally, when they were changing to the gown, they found it and they were arguing, you cannot take it from me. I paid a lot of money to get this mushroom to the country, and I want to take it because it is helping me to get better. So these health beliefs are still there, and we have to make sure, although we are respecting patients' ethnicity and cultural and beliefs and background, but we have to make sure that this will not affect the treatment. And the other thing is we may have also unconscious thought or implicit bias, which may impact our clinical interaction with our patients in terms of educating them. For example, again, I remember we had a Hispanic lovely patient and coming to clinic and on immunotherapy, and midway through the treatment, patient was complaining she developed immune related arthritis, and she was complaining she could not move her arm, her shoulder. It was really hard for her, and she said, I have pain. And we were just giving her over-the-counter anti-inflammatory NSAIDs medication to take. And it got to a point that the patients, after further treatment, got a frozen shoulder and could not at all move. And the nurse was asking the patient, so why didn't you report that? And the patient was saying, I was telling the nurse that I have a lot of pain, questioning the nurse who was not familiar with providing a culturally humble manner, the education to the patients, did not notice that, because she said the patients did not have any facial expression of the pain. Because if the patient was in a lot of pain, you could have seen that in the face. There are different cultural background. When they talk about their pain, you don't have to even they talk. You can see that in their face. They will just come to the room moaning and sometimes screaming of the pain. The pain may not be that bad actually, but this is the way that they will present themselves. But for this very specific patient, the patient did not do that, but was in such a severe pain, and the nurse just but it is an example of implicit bias. The patient, my other patients, when they have this pain, they moan, they scream. I can see that in their facial expression or in the body movement, body language. But this patient did not have anything. So I did not recognize that the pain is too bad. So I did not prescribe or ask the doctor to prescribe any narcotic even for the patients. So again, pain perception is different in different cultural backgrounds. In our center, we have created educational resources in different languages. The videos have been about immunotherapy. What is immunotherapy? What is the difference between immunotherapy and chemotherapy into 9 different languages. So we did a search in our area of what languages majority of the languages are coming to not only to our center, but in our catchment area. We also added Spanish language because we are collaborating with SITC, which is a Society of Immunotherapy in Cancer in US. And we have provided them all the videos. It is in their website because the Hispanic, patients speaking Spanish, they definitely benefit from that. And we have got very good feedback from that. So all different resources in different languages are available, which we will share that with you at the end of these videos in separate section. And you can go to all these resources and look at them and find out what would be the best you can. You have educational posters for patients in very easy language, so they will understand. Color-coded posters, you can just print it in PDF and post it. Education for emergency doctor posters to post in your emergency departments, and of course, educational posters in clinical area for new staff that are not really familiar with immune-related adverse events. So encouraging our patients to report starts with a good communication and a proper training and education. Sometimes there are patients, they don't want to repeat that for you. If I ask them to let's go through what you learned, they may be offended. You think I am, for example, I am a lawyer and I am a well-educated person. I don't have to repeat that for you. So we have to be very careful if we want to do kind of a role play or bring up the question in a very good way, so the patients will not be offended. And because if they repeat what they have to do, we have learned that as nurses in brain fog courses, that if you repeat that answer, the patients will be embedded in the more deeper spaces in the brain, so they will not forget that, rather than I will do all the talk and the patient just sit there and nod the head, yes, I got it, I will review that later. So doing a quick role play or just asking what are the most 3 important side effects that if they happen, you will pick up the phone and call me. Let them to tell you, because they will learn that better if we do that kind of education. So these are different examples that I can give you in terms of making sure we are providing the right education to the right patient population with coming from different cultural background, and making sure that we are always there for them, be a good listener, and you can hold their hands if they want that, because you will see the difference when you do that. They feel very safe and very trusted, and you will be always there for them. They feel it, and they will call you at the right time, which would be a win-win situation for our patients. We are doing immunotherapy for a very long time, from clinical trials 20 years ago till now, with all these advances on immunotherapy. So our patients, we see like more than 15 years survival on melanoma. This is amazing on immunotherapy. So the treatment works if you have a proper education and training based on their cultural background and diversity of the patients.
Thank you, Massey. And I think that was really wonderful explanation. And I agree with you, a lot of these culture background patients do believe in herbal medicine. Coming from an Asian culture myself, my parents, my grandparents um, do believe, herbal medicine is the treatment for everything. But with immunotherapy being so new, we're still trying to figure out and understand how the herbal medications interact with immunotherapy. And a lot of times that we have actually seen that patients are on herbal medication, herbal supplements, does affect um, the treatment itself. Side effects such as hepatitis we have seen related to herbal medications with immunotherapy. Once we ask them to hold their herbal supplements, magically the liver function is back to normal again. It is sometimes difficult to have them stop taking these herbal medication, and I totally understand. We have experienced this before. Um, it's not easy, but a little bit of education, a little bit of explanation does go a long way. Encouraging patient to report side effects as early as they can is important as well for their to continue, in order to continue the treatment safely. Um, in our practice, we pretty much, tell the patient, don't feel like you're bothering us. We want to know that you are experiencing any side effects, even if it's like one episode of diarrhea. We want to know. A lot of cultures, they don't want to bother you. They don't want to call the office with very little, every little thing. But, you know, we do tell them we want to know, even it's minor, please let us know. And I think with that kind of encouragement, that kind of um, relationship, they do report the side effect as early as they can. So thank you so much for your expertise.